Hi, I'm Dr. Michael Taggart with the Kirkland Health Institute and Lake Washington Chiropractic. I've been in practice right here in Kirkland, Washington for over 20 years. What makes my practice unique and different is I specialize in helping people overcome chronic health conditions. And I want you to know that I have a real passion for helping people who have been to many offices and seen lots of doctors and have not received help. We get tremendous results in our office, and the reason that we do is I have advanced training in neurology, spinal rehabilitation, and also in functional medicine. Now, functional medicine is different than traditional medicine. Traditional medicine looks at primarily disease and dying tissues and treats them with drugs and surgery. Functional medicine is different as we look at the underlying mechanisms and dysfunction and causes which can cause syndromes and symptoms, and if left unchecked can develop into a disease process. So we use more sensitive testing that often finds what the traditional medical tests have missed. We also use nutritional therapies, all natural therapies like nutritional therapy, detoxification, and also neurological therapies. Any chronic condition that you have, it's very important that your nervous system, your brain, your spinal cord, and the nerves are all working properly to give you the best chance to make a recovery. There are over 900 chiropractors in the Puget Sound area, only 2 of which use full neurological and metabolic protocols to help their patients. Dr. Michael L. Johnson, a chiropractic neurologist, wrote this book a few years ago, What Do I Do When the Medications Don't Work? A Non-Drug Treatment of Dizziness, Migraine, Headaches, Fibromyalgia, and Other Chronic Conditions. He developed the Neurometabolic Supergroup, which I'm a member of, and these are doctors throughout the United States which are dedicated to helping people who have chronic conditions find solutions. Dr. Johnson created a website called Life Changing Care, which is to help educate the lay public about what we're doing with the Neurometabolic Supergroup, how we can help patients. Some great videos I would encourage you to watch to talk about some of the therapies that we do. There's also 1,500 testimonials on that website. There's more added on a daily basis. Most of these patients were told by their doctors that there was nothing more that they could do. They would just have to go home and live with their condition. Thankfully, they didn't listen to their doctors. They kept searching, kept learning, like you're doing by watching this video today. And they didn't give up, and they finally found the right doctor, and they got the therapies that they needed, and it changed their whole life. So I definitely recommend you spend some time on that site. If you'd like to see some of my patient testimonials, you can go to Find a Doctor tab, and then Washington State and my name, and you can watch some of my videos. So definitely spend some time on that site. Additionally, I consult with these doctors on the board to improve their clinical outcomes. I also consult on difficult cases, so if I can accept your case in my office, you are in the 1% club. The information I'll be sharing with you, 90% of it you've probably never heard before. So I would recommend you maybe take some notes or watch this video more than once because I'm going to be giving you a lot of information today. The practice website is kirklandhealthinstitute.com. There's a lot of other great information there as well, so spend some time with that website as well. So what's causing my pain? That's what everyone wants to know. If you have chronic pain, it means that you have massive inflammation going on in your body. Now, when you have inflammation, what that's affecting is affecting pain-sensitive structures, it's altering brain function, it's affecting your gland-to-gland communication, which is your hormonal system. It's also likely affecting your immune system. And it's also stressing your detoxification pathways. So how did I get this inflammation? You have this inflammation because you have a metabolic or a body chemistry imbalance that's promoting inflammation. And also it's likely that you also have a structural and or neurological problem that's also promoting inflammation. So let's talk about the metabolic component for a minute. Several things that can promote inflammation metabolically in the body. One big one is blood sugar. That's huge. Many people in our society are developing blood sugar problems. When you over-secrete insulin, that is inflammatory, so that promotes inflammation. Poor gut function is a big one. When you have digestive issues, that inflammation can not only be in the gut, but can also move to different parts in the joints through the blood system. It can also affect brain function. And you can develop something called leaky gut, where because of inflammation, the membranes in your intestines weaken, and then what happens is that things that shouldn't be leaking through, leak through, and as a result, it creates inflammation, your immune system activates. And that's something that can be a big issue for people who have chronic pain, and you can develop food allergies. And so as a result of eating certain foods, you get a new round of inflammation every time you eat them. So this is an important thing to look at. Also, when you have inflammation, it also promotes, and especially if you have digestive issues, it promotes autoimmunity. Many, but not all patients who have chronic pain have autoimmunity. So this is something that we really look into, because a lot of people who have the immune issues it attacks the joints, and that can be a perpetuating factor of why you have pain that's been chronic. So that's something we have to look at. Now, how would we know if you have this inflammation? Well, there's different tests that we can do to determine if this is happening. We can do something called a uric acid level test. We can also do a HbA1c test, which is a means of checking your insulin levels. We can also check something called C-reactive protein, which will give us an overall level of inflammation in the entire body. We can also check homocysteine levels and also cortisol levels. We can also check your pH through saliva and urine. Your body should be mostly alkaline. Your digestive system is acid, but the rest of your body should be alkaline. So if we do these tests and it shows that your body is too acid, that's something that will promote inflammation, and also is a disease-promoting pH. So you want to be alkaline in your body. So we would do this testing via blood tests, urine tests, and saliva tests. Now let's talk about the structural issue. You may have issues with spinal nerve stress throughout your spinal column and perhaps your discs. You also may have entrapments in different areas of your extremities, like your shoulder, your elbow, your wrist, your hip, your knee, and your ankle. You may also have issues with what we call the meningeal system. A lot of people haven't heard of that system, but there is a system in their body that actually tethers your brain to your skull. It separates the hemispheres of the brain. It actually attaches to your cranial nerves, which controls all of your organ functions. It attaches tightly to your neck, loosely to the rest of the spine, and also to your low back. So if that system gets pulled or has torsion in it, it can set off pain receptors, and it can also affect organ function and also your entire nervous system. So that's something that we evaluate in our office. You also may have a myofascial pain syndrome, where you've had damage to your muscles and your muscles aren't functioning properly. We may have to do myofascial techniques to help get the muscles working better, like with trigger point therapy. That can be a very important thing for chronic pain. Now let's talk about the neurological or the brain component of your chronic pain issue. We have a saying in our office: if you have chronic pain, we must treat your brain. Now why that's true is that a healthy brain dampens pain. So if you have chronic pain and it's not been getting better, it's likely that there's something neurologically that's going on in the brain that's perpetuating that cycle of pain. Well, how would we know if you have a brain issue? Well, we'd have to do what we call a functional neurological exam. Now, that would be different than a medical doctor neurological exam. A medical doctor, a neurologist, would be looking for tissues that are completely broken, tumors, or things that have burst, like an aneurysm. So the exam that I'll do will be different than that, because I'm looking for things that are still functioning but not to the level of health, which are creating symptoms and keeping you in pain. Once we do that evaluation, we'll be able to find what other doctors have missed, and we'll be able to do something called brain-based therapy, or sometimes called functional neurology, which will give us information, and we'll do different therapies that will help the brain balance and work better. That will help your overall health and also dampen your pain. The brain has this amazing capacity through the principle of what we call neuroplasticity to change quite rapidly. Just like a piece of silly putty, you can make it into different shapes. By doing different stimulations and therapies, we can get the brain to make some changes quite quickly. And you'll be amazed after we do the exam and we do some brain-based therapy about how much better you'll function just after that first visit. We'll talk more about some of these mechanisms of the neurological dysfunction, also more about brain-based therapy, and also more about the metabolic issues a little bit later in the video. There's also another therapy that we use in the office called cold laser therapy. And cold laser therapy is something where it uses wavelengths of light which penetrate the tissues of the body to promote healing. What it does is it promotes natural endorphin production, also reduces inflammation by suppressing inflammatory enzymes that create swelling and inflammation and heat. It also improves lymphatic drainage, releases tight muscles, and also helps your bones repair faster and improves cell growth. Now, in order to help you, we've got to address you neurologically and metabolic. That's so important. And we address that, we're going to help your brain, your spinal segments, your discs work better, your extremity joints. We're going to balance your body chemistry and help your detoxification mechanisms work better, and all of that is going to decrease that inflammation that's causing your pain. And no doctor has done that. That's what makes our office unique and different, and that's why you haven't improved. Now, it's important to understand that all chronic health conditions have common threads. So whether you have irritable bowel syndrome, Crohn's disease, type 2 diabetes, vertigo, dizziness, peripheral neuropathy, chronic headaches, insomnia, or whatever chronic condition that you have, what's going to be consistent with those different conditions is that there's going to be underlying metabolic processes that go on in your body that are not working right. So let's talk about some of those. So the metabolic imbalances would be anemia. If you have anemia, it means that you're not getting enough oxygen to the cell. That is going to be very devastating to your health, and you're never going to improve if that anemia isn't addressed properly. Thyroid dysfunction, I talked a little bit about that. Every cell in your body has thyroid receptors, so if your thyroid isn't functioning properly, that is going to be have a huge impact on your overall health. If your blood sugar is unstable, blood sugar imbalances are probably one of the most common condition that we see in practice, and it contributes to a lot of health conditions, and it's part of the reason that as Americans that we are developing obesity. Obesity is a huge problem in our country. So you may have diabetes, or you may have a situation where you have what we call insulin resistance, which is pre-diabetes. So if we're not getting enough sugar to the cell, that's hypoglycemia, that's going to be a problem because you're affecting the fuel source. If the mixture is too rich with insulin resistance or diabetes, that's inflammatory, it's going to cause inflammation in your body. It's going to be, it's a particular common factor when you have peripheral neuropathy. The blood sugar is, when it gets high, is toxic to the nerves, it inflames the nerves, and you start getting tingling, numbness, and you start losing the feeling in your feet and hands. Adrenal gland dysfunction is very important because your adrenals are your anti-inflammatory organ, and they also are very important for energy level. So that is something that needs to be addressed. You may have other hormone imbalances, whether male or female or both. Autoimmune conditions. Autoimmune conditions are responsible for many chronic health conditions. Digestive is very much involved with autoimmune. And when you have bad gut, it actually sets you up for having an autoimmune condition. So if you have a bad gut, you have irritable bowel syndrome or another condition like GERD, you're actually increasing the risk factor that you eventually develop an autoimmune condition because 80% of your immune system is in your gut. And when the gut becomes dysfunctional, your immune system goes into hyperdrive and it's going to start attacking your tissues. It can very much also be involved with vertigo and dizziness and balance disorders. We see that commonly, and also can be involved with headaches as well. Hidden infections, we talked about that. There's innovative ways that we find them. We find hidden infections on every single chronic condition patient that we see, or maybe not 100%, but probably 98% of them. All of these imbalances create chronic inflammation, which gets in the way of your cells function. When your cells don't function, you're not going to feel well, you're going to develop problems. Also, neurological imbalances. The brain, the spinal cord, and the nerves that exit between the bones of the spine make your body work. In order for your body to work healthy and to resist disease and to overcome disease, we have to make sure that that system is functioning properly. Now, when we talk about brain problems and neurologic problems, we're not talking so much about a disease or a tumor or nerves that are cut in half. We're talking about a lack of firing of the brain and an interference in the peripheral nerves or in the spinal nerves that are breaking the connection between the brain, the body, and the body and the brain. Now, many people come into my office with a condition and I'll say, well, what has been done so far? I said, well, my doctors run tests, but they don't find anything wrong with me. So let's talk about that for a minute, because I hear that all the time. And what happens is that there's actually two criteria for laboratory testing. There's two different parameters or groups of data that are used. One data, which is the traditional range, is actually based on all the people who went into the lab last year, and all of their blood work is averaged together, and you basically create a bell curve. Now, the problem that I see with that is that a lot of those people who went in and had that blood work, some of them had cancer, some of them on oxygen, so you get a lot of data from unhealthy people. And if you're using unhealthy data from people to try to determine what optimum is, you can't really do that. That makes no sense to me. So what we do is we use the functional range, which is a much tighter range, and it comes from people and data from people's blood works who have health. They have good energy. They don't have disease. They don't have dysfunction. So that's what we want to shoot for, is we want to get you into the functional range. So here's how this plays out in my office. A woman comes to my office. She thinks she has a thyroid problem because she has classic symptoms. She says, my hair's falling out. I'm gaining weight and I can't lose any weight even though I'm on a low-calorie diet. My hands and feet are cold, I'm depressed, and my bowels don't move well. That is classic low thyroid. She gets a blood test done, reports to her medical doctor. The traditional range, the range that she shows up is 4.2. The range that they use is 0.3 to 5.7, which is too broad. She does have functional hypothyroidism, but because it doesn't fall within this really broad It falls within this really broad range. They say that, well, we can't find anything wrong with you. We don't know what to do. Person gets frustrated and they keep getting sicker. Not a good thing. So this person comes into our office. We use the functional range and we say, okay, your thyroid is low. It's not working well. And we set out a program to correct those imbalances so that person can overcome their thyroid problem. So this is how it typically plays out in the office. So it's just a very important point in the video is that there's different ranges, and that traditional range is way too broad, and that's why it misses so many problems. So they tell you there's nothing wrong with you, but you feel terrible. So I always tell the patients, well, how could there be nothing wrong with you if you feel so bad? Obviously there is something wrong, they just haven't found it yet, and that's what we do. Now in order to dig a bit deeper, we have to do some pretty comprehensive laboratory work. And so there's several things that we have to do that it's going to allow us to find on the metabolic side of your health what we need to do to help find the cause. We're going to run a complete thyroid panel on you. Most doctors run one number, which is the TSH. We're going to actually run 6 different tests. That's the only way that we can thoroughly evaluate the thyroid. We're going to look at your vitamin D levels, kidney function, very important, your liver. We're also going to look at your red blood cells to see if you're anemic or you have a B12 or a B folic acid deficiency. We're also going to look at your lipid panels to see if your triglycerides or your cholesterol is rising. We're also going to do systemic inflammatory tests. Most of those tests aren't done. C-reactive protein and homocysteine are overall signs of inflammation. They don't tell us what's causing the inflammation, but they tell us that you have it, and so we have to search for it. Those tests are usually not done. We're also going to look at your white blood cells and do a complete white blood cell count by looking at the different white blood cells, your neutrophils, your monocytes, your eosinophils, and your lymphs. It'll give us an indication of where your immune system may be fighting an infection, and then we're going to investigate further. We may do an immune challenge test where we challenge the immune system to see if you might be Th1 or 2H2 dominant, if we're suspicious you have an autoimmune condition. We're also going to do an adrenal stress index test where we check your adrenal hormone levels over a period of about 12 to 16 hours. We're going to take readings at different times of the day, and your cortisol production should have a rhythm to it. It should be high in the morning because it's stimulatory, and then go low at night. Lots of patients who come to my office have it reversed. It's low in the morning, so they're very tired, and then at night, the cortisol level, because it's stimulatory, they can't sleep. So that's something that we have to look at. We also want to look at DHEA and some other hormones as well. We may also add a male or female hormone profile to the adrenal test. It's very important that we have that information. We're also going to look at food sensitivities. Many people who have chronic conditions are going to develop food allergies as one of the primary causes of the problem, or definitely it's going to be a result of a bad gastrointestinal system. So things like gluten, soy, yeast, egg, milk are pretty common. We're also going to do comprehensive stool analysis because your gut, again, your immune system, 80% of your immune system is in your gut. If you have a bad gut, you're setting yourself up for a chronic health condition. Now, the functional medicine approach is what we're going to do is we're going to tailor make this program based on what we find. A lot of doctors' offices you go to, if you have a condition, you always get X treatment. Well, everyone who gets X treatment, that's not really looking deep enough to find out what's causing it. So we're going to be very specific. Your program will be unique to you because the problems that you have aren't the same exact issues that another person has, even if you have the same condition. So it's very customized. We're going to calm down the immune response if it's present. If it's gone into autoimmune. We're going to support the adrenal glands. We're going to support your blood sugar. We're going to clear out any pathologic organisms that we find. We're going to repair the gut. We're going to do neurological therapies to reconnect the brain to the body and the body to the brain. We're going to detoxify the liver and balance the gallbladder. We're going to eliminate any food reactions by a change of diet. We're also going to address anemia. If you have any hormonal issues, we're going to address that. So this is not about treating your disease. I do not treat people's diseases. What I do is I treat the cause of it, and your body's going to heal itself. That's very important to know. So we also need to examine and address the system that controls all these systems. That's your nervous system. So let's talk about the brain a little bit. So here we have the cerebellum. The cerebellum is the back part of your brain. It controls balance, coordinated movement, and the tone to the spine. It's very important if you have dizziness, vertigo, or a balance disorder. This area right here is your brain stem. Your cranial nerves come out of this area, so all your organ function is going to come out of this area. Your blood pressure, your heartbeat, respiration, and your digestive system is all going to come, the nerves are going to come out this way. This area over here is your cortex, the different lobes, occipital lobe, parietal lobes, temporal lobes, and the frontal lobes. Those are all the different parts of the brain. Now, what can happen is that there can be dysfunction that starts in the different areas of the brain. So let's talk about normal function first. So what happens is that information comes up through your nervous system, information from your feet, from your environment. It's going to go up your spinal cord, and it's going to stimulate your cerebellum, again, which is in the back part of your brain. That information is going to stimulate your opposite cortex. It's going to stimulate this side of the brain. And that left side of the brain is going to stimulate the lower brain stem, the lower part of the brain stem. And then that part of your lower brain stem is going to inhibit the upper brain stem. That's also called the midbrain or the mesencephalon. It's very important. Your midbrain is your headquarters of your fight or flight response. You may have heard that term before. It's where your sympathetic nervous system is housed. And so what happens is that if we have an imbalance that occurs where we don't get that input, say, from the right cerebellum, the left brain is going to become weak, and then it's not going to inhibit the lower brain stem, and this midbrain is going to have nothing to hold it back, and it's like a team of horses that there's no one pulling back on the reins, and it just goes crazy. And as a result, your body goes into fight or flight, or you get into a sympathetic overdrive in your nervous system. There's a tremendous amount of health problems that stem from this issue. So now why would this happen? Well, there's some kind of chemical or inflammatory insult that's caused this to happen. There's been physical trauma recently or years ago, concussions, different traumas. There may even be an emotional component to what's been going on, stress that you're going through now or that you went through years ago. So any of these factors will actually decrease the ability of the neurons to fire in the brain. So let's go through some conditions that can result with this overfiring of the mesencephalon or the midbrain. If you have a sympathetic nervous system that's really jacked up, what will happen is that you might develop light sensitivity. The nerves that open your eye, your pupils, will open even wider, and all of a sudden you'll be blinded by lights. You won't like to go outside on a bright day. That's a sign that your nervous system is in the sympathetic dominance and it's opening that pupil. Now, you also may develop chronic pain and fibromyalgia. When your mesencephalon is overfiring, it overstimulates your adrenal gland and you make too much norepinephrine and epinephrine. And what that does is that when those levels get high, it stimulates all of the pain receptors that are the C-type pain receptors, and it creates whole system body pain. Or it may perpetuate a chronic pain syndrome in just one area of your body as well. Now, the centers that control your urination also come from that brainstem area, and so it could set you up for chronic urinary tract infections. If the brain is overfiring, it may set you up for migraine headaches. It also can make your heart race, and also can set you up for not being able to sleep. And when you don't sleep, you're going to get very tired. There is a bundle of nerve tissue next to the mesencephalon that controls your wake-sleep cycle. It's called the mesencephalic reticular activating system. It tells you when you're supposed to be awake and asleep. However, because that midbrain is so close to this, when this overfires, This also upsets the rhythm of that bundle of nerves, and you have issues of not being able to sleep well. So let's talk about some other areas of the brain and the resulting dysfunction that can occur when other areas of the brain are not working well. If you have episodes of depression or anxiety, the right or the left brain, the cortex, could be involved. If you have difficulty scanning pages, it may be due to a cerebellum. Your mathematical side of your brain is your left brain. If you have trouble with those type of calculations, you may have a weakness in the left brain. Your right brain is your musical, creative side. If you have trouble with that or have issues with language, that's typically a right brain problem. If you have trouble understanding what others say to you, that's a temporal lobe problem. If you have a peripheral neuropathy, the parietal lobe controls sensation, so if you end up with tingling and numbness and not being able to feel your hands and feet, the parietal lobe is often involved with that. If you are more irritable or angry, that's typically a frontal lobe problem. If you have trouble with balance, tipping and dropping things, that's a cerebellum issue. If you have trouble with learning, like you have dyslexia, learning disorders, that's typically classically left brain. If you have ADD, ADHD, that's a right brain problem. And we have therapies that help to stimulate these parts of the brain so that these areas of the brain can heal, and we'll talk more about that in just a minute. So when we have these functional brain problems, what do we do about it? Well, we do something called brain-based therapy, which is an amazing therapy. And 20 years ago, some scientists figured out that your brain has a property called neuroplasticity. What that means is, like a piece of plastic that can be moved into just different shapes and changed, your brain can also be rehabilitated. Just like a bad shoulder or a bad knee that you go through rehabilitation to heal it, the brain can be rehabilitated. Now, what's interesting about the brain is the brain actually heals a lot faster than these other tissues. When we do our neurological tests and we do therapies, we find immediate improvement on our post-testing. It's quite amazing for people to observe this, and they get quite excited when they can see how they're immediately better after we do some of these therapies. So the brain and the cerebellum require two things to work. They require fuel, and that has to do with your glucose. We talked about the importance of blood sugar balance, and also in oxygenation. As you get older, your tissues don't oxygenate as well. So one of the therapies that we do is we have put people on supplemental oxygen to help give those neurons some extra fuel so they can heal. The second thing you need for your brain to work better is you need activation and stimulation. So there's different therapies that we use to do that. So we're going to use therapies like balance therapies. This is especially helpful if you have a dizziness, vertigo, or balance disorder to help improve your balance. That's mostly stimulating the cerebellum. Vibration stimulates the parietal lobe, which is important for peripheral neuropathy. Also stimulates other parts of the brain, especially the cerebellum. Postural exercises, auditory stimulates the temporal lobe. Visual eye tracking is a very powerful therapy to help improve the brain. They may do certain light stimulations. Olfactory stimulations also stimulates the frontal lobe and also the temporal lobe. Vestibular training, where we have you do certain exercises to actually stimulate what are called the canals, which are different parts of the inner ear, to help your brain kind of relearn what it needs to do to help you be able to know where you are in space and to help keep your balance. Chiropractic adjustments are also part of the program when they're necessary. Chiropractic adjustments stimulate brain. Now, what things that's unique about what we do is we only do them on one side of the body because we have an imbalance and we're trying to balance it out rather than stimulate both sides and still have an imbalance. We only do it on one side of the body. Rhythm and timing exercises are also important for cerebellum and also for frontal lobe. So, with a thorough evaluation, both neurologically and metabolically, we're going to look at all the different factors. We're going to look at your cerebellum, blood sugar problems. Is there an overfiring of the midbrain? Are there hormone problems? Is there an autoimmune condition? Or is there cortisol issues? And we're going to put all those conditions and pieces together to treat you as the whole person, addressing every cause. So from watching this video, you should be realizing that instead of the primary condition that you're concerned with, you probably have a lot of other conditions as well. And you should also be realizing that you really have not had a comprehensive evaluation, and so as a result of that, you really haven't been given a fair opportunity to improve, and that's why you still suffer. So what are you going to do about that? So what's next? Well, what's next is you need to make an appointment in my office so we can evaluate you, so we can turn your health around. So here's what the visits look in my office. The first visit, we're going to do a complete neurological evaluation. You're going to bring in any previous labs that you have. I'll look those over. And also you're going to bring in all the paperwork that we'll email you, have it completely filled out, and we'll go over that information with you. I'll do an interview and ask you different questions. I also would like you to watch this video again a second time because there's a lot of information here, and please watch it with your spouse or significant other because they have to know what's going on and support you through this process. What visit 2 is going to look like. We're going to do I'll had time to review your case. I'll also have had time to look at any other blood work that we're going to do. We also may talk about other testing that we're going to do. I'll let you know if I can accept your case, and I'll let you know my opinion about what's going on. We'll review your neurological findings, and we'll also discuss your treatment plan. We'll also review any financial obligations. Your significant or your spouse must be on that visit because they have to be supportive of your program. They have to be, there's going to be lifestyle changes, and they have to be 100% on board to support you not only emotionally, but also be totally on board with the decision that you're going to make as far as the financial obligations go. And I'm going to ask you to make a decision about your care on that second visit. I can only accept a limited number of new patients who have chronic conditions. The first 2 visits to my office are $350. We do a very thorough, comprehensive evaluation. It's the best exam that you'll ever have in your life, I can guarantee it. Now, because you've watched this DVD, because I've spent some time educating you about what I do, and it saved me some time, I'm willing to give that first 2 visits to you for $49. That's quite a savings. But I'm only willing to do that for people who are serious about getting better. So if you give us a call right away, we'll honor that $49 special. Both those visits we want to complete it in the first 2 weeks. Our office is very busy. We have to make room for more new patients. So here are the rules of acceptance into my program. You must be willing to make a serious lifestyle change. Like if you have a gluten sensitivity, you have to be off gluten 100%. Because if you don't follow what I do, then we're not going to get the results that we should. Now, being gluten-free is not that difficult. There's all kinds of gluten-free that. I'm gluten-free. If I can do it, you can do it. And if you do have a gluten problem, you'll find that your health will improve tremendously if you stop eating gluten. Now, you've got to take accountability for your health. You've got to realize that you're responsible for your health. No one else is. Your spouse isn't. Your insurance company's not responsible. Your responsibility. Now, insurance and or Medicare, I want you to know, pays very little for my program. It'll probably pay for some of your labs. However, we have made our care plans affordable, that 96% of people who see our office can see us and get the care they need by spending anywhere from $150 a month to $300 a month for 12 or 24 months, depending upon what the need is. Now, sometimes people have this insurance mentality. Well, they say, well, if my insurance is going to pay for all this, then I can't do it. Well, if you haven't been noticing lately, insurance is paying for less and less, and it's getting more and more expensive. So people are paying more out of pocket as a general trend. Now, what's interesting is that I noticed that a lot of people go on expensive trips, buy fancy gadgets, and have really nice cars. And I think that's all great, and I totally support that. However, I want you to understand is that your insurance company does not pay for any of that. And you have those things, those nice things, because you want them and you deserve them. However, you also need to realize that if you want cutting-edge, life-changing care, you're going to have to dig in your pocket a bit. And like we said, we have some payment plans that can make this affordable for you. So once we've done the necessary test, we'll set up your neurological and metabolic protocols to help you get better. Now, here's what I want you to ask about this condition that you have. I want you to ask yourself, how has this condition affected your job, your relationships? How much has it cost you already? How is it affecting your family dynamic? And also, what recreational activities can you no longer do? What have you given up in life because of this problem? What does it cost you in time, happiness? How is it affecting your sleep? And where do you picture yourself in 1 to 3 years if this condition is not taken care of soon? And what would it be worth to you if your condition could be improved? What would happen if you made the right decision and give our office a call to have an evaluation to see if we can help you? And how would your life be better in the next 20 to 40 years if you got care and we treated the cause? How much better would life be in the long term? Again, for 20 or 40 years, depending on how old you are. And what would happen if you decide to let this opportunity slip by? And can you live with that decision long term? I hope you've enjoyed watching our video today. And I hope that you not only enjoyed this information, but I hope you also take it to heart, because this information is just that, it's information. If you don't take action, nothing is going to change. And that would be a tragedy if nothing changed. So I'm really going to urge you, if you are serious about turning your health around and getting the type of health that you can achieve and that you deserve, give us a call at 425-821-1101.